Welcome to the Heart Rate Variability Podcast. Each week we talk about heart rate variability and how it can be used to improve your overall health and wellness. Please consider the information in this podcast for your informational use and not medical advice. Please see your medical provider to apply any of the strategies outlined in this episode. Heart Rate Variability Podcast is a production of Optimal LLC and Optimal HRV. Check us out at optimalhrv.com. Please enjoy the show. Welcome, friends, to the Heart Rate Variability Podcast. I'm excited to welcome back Dr. Stephen Paliakas to the show. We had a great episode with him. Steve, I think it was a few years back now.
Yeah,
talking
that's right.
about your incredible, diverse expertise, experience. We didn't dive that much into your amazing life story as well. So when I was thinking about this series for interviewing folks like yourself around your personal wellness and health, the habits you've built, the practices that have really impacted you in your life, and just kind of what your day looks like and how you integrate all this knowledge and experience into your day. You were one of those people that came right to mind as somebody I needed to interview. So just in case there may be some folks, and I suggest you can stop here, go back, listen to that previous episode. But in case people haven't, heard your introduction, can you just give folks a brief introduction of who you are and your work?
Steve Paliakas, DC. I'm in Wheaton, Illinois. I'm a chiropractor and an acupuncturist. I've been in practice we're going on 25 years. I got into health and wellness as a patient as a kid. I had recurrent sinus infections, the worst of which put me in the hospital. When I was 15, I had a staph infection that was so bad it had perforated the sinuses and my eyes were swollen shut. I was in the beginning stage of meningitis. Kind of scary in hindsight, as a 15-year-old, you're ignorant to a lot of things. The IV antibiotics stabilized me, and the ENT had a very honest guy. He just told my mom, said, all we can do with this kid is just throw antibiotics at this, look at something alternative. And, my mom took me to a chiropractor and making some pretty bold claims. And it was a pretty simple thing, actually. The curvature of my neck was reversed and my sinuses weren't draining properly. And, it was actually a pretty easy fix, and I didn't get infections so much. And, flash forward a number of years, I just like the fact that within the health and wellness industry that was conservative, low tech, try the natural stuff first. Doesn't work, go to the next level of invasivity. And so that's kind of my MO professionally. And I'm not a very dogmatic chiropractor in a sense that I view spinal manipulation, chiropractic treatment is an incredibly powerful modality, but it's a modality. And in the state of Illinois, we have physician status. So in our scope of practice, for the chiropractic profession, it varies state by state. So in Illinois, we can diagnose, we can order imagery, blood work. Because we have physician status, you're also, you definitely have to always be thinking, is this somebody that needs a medical referral too, but not selling ourselves short either, with that. So that's why, some people might be a little curious, why is a chiropractor also doing acupuncture, right? And my journey with heart rate variability, it actually, I was thinking about this, that it started with, just coming across patients that had a lot of accessory muscles of respiration that were overactive, scalenes, SEMs, and, they're, looking at me for a solution. And that kind of led to, well, let me bone up as a clinician and me personally, bone up on proper breathing techniques, because, and learning about the differences between stress breathing and relaxed breathing, right? And it's kind of a side note, just something I wish I had discovered the power of breath earlier in my life. Hindsight is 2020, and I'm not going to quote Frank Sinatra. I did it my way, but but
you got there. I have a similar journey. We both got there eventually, at least.
and so I was thinking, I'm a former smoker. Turns out I have cystic fibrosis
Mm.
trait, so I'm a carrier. I have 5 kids, and one of my children has cystic fibrosis. I'm thinking, man, I dodged a bullet because I grew up in the 70s, and everybody smoked in my family. My
Yeah.
parents, my aunts and uncles, my siblings. And so for me, that was just part of an adult, me becoming an adult. I'm going to start smoking cigarettes, which in hindsight was like horrifying, you
Yeah.
know? And so, looking back to just how I handled stress, um, and just what a powerful tool the power of breath is. And, it's something that's so simple, um, that, it's something I'm acutely aware when I encounter people, in practice and or on the street or wherever, that, when we're talking about, oh, they're under a lot of stress, I'd do the first thing. Okay, tell me what your breath work looks like. Breath work?
Yeah.
What's
Exactly.
that?
Yeah.
You know, it's like, wow, and I know this is not, breath isn't something new. It's been around as long as
Yeah.
animals have had lungs. How I
Yep.
don't know if we include fish in there, but but think of all the traditions, Eastern, Western, and
Right.
globally, everybody, through all cultures and traditions have, if at a minimum, have stumbled upon this, but at a higher level, it's breath is incredibly well developed. Yeah, so I'm kind of all over the place here, but so in practice, I've
Yeah, I'm curious
incorporated.
how you
Yeah,
like all this learning and my experience with chiropractors is that unlike maybe some other professions that are related in the healthcare arena, they're a more insightful, reflective, holistic person
yeah,
and the training I think from what I very little I know as an outsider sort of supports that as well. So I'd
yeah,
love to hear how you went from a smoker, chiropractor, and then just
yeah,
again integrating all this knowledge on healthy breathing and everything into your own life.
yeah. Well, I think with a lot of us in the health and wellness space, we're driven by, you know, what can I do to help somebody?
Yeah,
And and this is also true of medicine. It's a science, but it's also an art.
yeah,
And so yes, I could follow dogma, and nothing against dogma. It has its
mhm,
proper place at its proper time. However, um, me being dogmatic as a clinician, I think humility is a great remedy against that.
yeah,
That I'll be the first to tell you, if I'm not helping you, I'm going to put you in front of a person who can.
yeah.
And with my skill set and my training, I can do a lot, but I can't do everything. And nor am I going to say that I've got the magic cure here in my pocket. If somebody's telling you that, get up and walk out the door.
Right, quickly.
Yeah, yeah.
And if they're
So
selling it to you in shake form, run.
yeah, so um, currently, I would say that the big tools in my toolbox that I use most frequently are obviously, chiropractic manipulation, spinal manipulation, lots of manual therapy, acupuncture, dry needling, rehab. Here's something I discovered. Actually, it was during the pandemic, and during COVID, I'm a solo practitioner, so patients would sit in the car, they'd shoot me a text when they were ready. I'd sanitize everything in between patients, and once it's clear, okay, come up. So I'm seeing one person at a time, every 45 minutes to an hour. Um, but the commonality, it's interesting, the commonality with almost all manual therapies, and you can even include like dry needling, and we'll even say acupuncture, and for that matter, chiropractic. And the founder of osteopathy, George Taylor Still, there's a lot of commonality in chiropractic manipulation and osteopathic manipulation. And George Taylor
Mhm.
Still in the 1800s saying, no, no, the mechanism of action is vasodilation, and that's kind of it's increasing blood flow and uh, D.D. Palmer and B.J. Palmer, the chiropractors, like, no, it's nerve interference. It's the subluxations compressing on the nerve. The reality is it's both. But
Hmm.
the elephant in the room when I'm seeing patients, it occurred to me during the pandemic when people are coming in, and because I saw the spike during the pandemic, and I'm like, why is everybody having increased myofascial pain, and then their spines are just locked up more so like ever. Obviously, their stress. It was a very scary time, very incredibly stressful. But we were all wearing our masks, and your oxygenation is not going to be great when you wear a mask. You're breathing in a lot more of your CO2, and so your oxygen saturation is going to drop down. And it occurred to me that the commonality with pretty much everything I was doing is increasing oxygenation of the tissue.
Mm.
If you want to get down to brass tacks, like let's say you've got a muscle spasm in your shoulder,
Yeah.
um, you could put heat on that. You can get massage. You could do some cupping. You could do some dry needling. You could do some exercise. That's going to increase the blood flow. You could do manipulation around that area. It's going to reset some local nerve function, get some blood flow. You know what all that's doing? It's increasing oxygenation of the tissue.
Yeah.
And that's the mechanism. If you get down to the physiological level, that increased oxygenation is disrupting prostaglandins. It's doing all kinds of really cool stuff down at the cellular level. I'm like, wow, what can I do to help people just get better oxygenated?
Right.
You know, and coming out of the acupuncture world, out of the traditional Chinese medicine world, blood stagnation is something that's talked about a lot as the cause of a great many ills for a person. And so many Eastern medicine modalities are focused at, blood stagnation, which goes hand in hand with something called G stagnation. Anyway, what can we do to increase oxygenation and blood flow? Well, number one would be exercise. Just get
Mhm.
out there for a walk or get your blood pumping, get the oxygenation flowing. And when you're doing that, there's breath that's happening. So that was kind of interesting. Then I stumbled upon the work of Wim Hof, and I thought that was really, really intriguing. In his breath and how, and he was explaining how through breath you're able to essentially hack your autonomic nervous system. It's the only
Yeah.
organ that we can willfully control. You know, I could argue, maybe your bladder and those things, you can willfully control those as well. But pretty much every other
Mm.
autonomic
Yeah.
or, organ function, we don't really have willful, deliberate control except for the breath. And by working on our breath, controlling our breath, we can kind of enter the system a little bit and start to impact that. Like, wow, that's amazing.
Yeah.
And then, so that I started getting into, researching breath. And then, Dr. David Hopper put out a continuing education here in Illinois for chiropractors, just learning more about HRV. And I'd been learning about HRV, and I stumbled upon the work you guys are doing. I was like, wow, I really need to. I can see this as a really powerful tool that can help impact with what I'm trying to do in the clinic. So, um, yeah, so like me personally, this has been really a very powerful tool. So in the morning, I have my HRV reader. I get that on as quickly as I can. I try to be consistent with using it, but my mom had a plaque hang on the wall in our house. Life is something that happens while you're planning something else,
Exactly. Yeah.
right? And so, and I'll tell this to patients because they get stressed out. Oh, I missed some readings, or I'm not. Just just
Yeah.
reboot, regroup, and do what you can, and don't get too stressed out about that. But the feature of learning the resonance frequency for breath, for me, that's been a real game changer, because I tried box breathing and
Mhm.
different stuff, and just a validation with the biofeedback. Like that's really what that's kind of the rhythm that my body jives with, really has come in handy. And I've been using it long enough that I have a pretty good sense of how to count that out.
Yeah.
So I'm 5.5. That's my resonance frequency. So I've with practice, I've been able to just get a sense of, when I don't have my reader handy and I'm just sitting in traffic, or, I'm getting stressed, like, start
Yeah.
breathing, So, um, Yeah, the journey thus far has been pretty wild, and it's exciting. This is a really exciting time to
Yeah,
be in the field for health and wellness, you
absolutely.
know? Yeah, and I think that the work of what you guys are doing with optimal HRV is pretty incredible.
Well,
Um,
thank you. Thank you.
yeah,
Well, it's
yeah.
an honor to
So
work with people like yourself and be part of your journey as well. So I'm curious because you mentioned like Wim Hof, which I really
yeah,
think is just fascinating, kind of that forced hyperventilation versus something as calming as resonance frequency breathing. And, we have all these different approaches going back to the yogis and probably before them, their teachers as well about how to manipulate the breath to
yeah,
improve health and wellness. So I'm just curious,
yeah.
like as you evolved as a person and a professional, how has your breathing practices sort of evolved to include resonance frequency breathing? Were you a meditator? Did you practice mindfulness? Just kind of like how did that inform sort of your own health and wellness and practices?
Yeah, so starting in my 20s, I discovered breath work uh, through meditation and prayer.
Hmm.
And so in just the centering quality of a breath, and that's as deep as I understood it. As okay, when I breathe in, it's helping me concentrate. Okay, I'm feeling more relaxed. Okay, I'm more present with my mind for where I want to go during that quiet time, right? Um, and so I've always used that. Um, the I guess I'm losing my train of thought here. So it's over time. It really hasn't been until around the pandemic that I started to become aware more of that. I stumbled upon a program. It's out of Harvard. It's called Optimal Work, um, and it's the psych. Dr. David Majors is his
Mm,
name,
yeah.
Majerus, MD, and this is sort of Harvard's. They're attached to Harvard's medical school, and in their program, which is sort of a work life balance program, it's a master class, and they really drove home using breath, especially at the beginning of when you're trying to do something called the golden hour, which is a state of neurologic flow where you're
Hmm.
kind of coordinating your hind brain and your front brain. And before you do that, they do about 3 minutes of just a general breath work. And when I encountered that, I'm like, oh, this is pretty interesting. And they talk a little bit about the power of breath and what that's doing. But it really wasn't until discovering optimal HRV that I started to go a little deeper on my breath work, and so incorporating that, you know, trying to build time in the evening where I'm just doing breath work for at a minimum of 3 minutes, 5 minutes. So setting a timer. Okay, I'm going to do
Yeah.
this now regularly for 10 minutes a day, or gradually working up to it. And again, sometimes life gets in the way and the habit starts to break down, and so it's just regrouping. It's interesting. Um, I've noticed that days that I've missed my breath work, my anxiety will start to trick up a little bit. And
Yeah.
even not like, major stuff, but I've noticed my responsiveness to local or to environmental stressors or things happening with work, whatever, that I'm feeling it. It's like, oh my gosh, I'm forgetting. I haven't done breath work in a couple
Yeah.
days. And I notice it's like if I forget or skip or travel or whatever,
Yeah.
2 or 3 days is like, man, I'm feeling it,
Yeah. Yeah.
you know?
I even felt like I have a very severe reaction to short-term reaction, but to vaccination. So when I get vaccinated, I just don't have it in me to do anything except moan on the couch. Like that. That's what
Yeah.
that's going to be my next 24 hours. I just got my shingles. So
Okay.
like I don't know if I've ever felt worse in my life, which is also probably feels a lot better than shingles would feel. So
Yes.
I'm okay
Yes.
with that short-term cost, but like. where I don't feel like doing my movement and breath practice. And
Yeah.
man, by the time the symptoms of the I'm feeling better.
Hmm.
I just cannot wait to do my practice. Like my energy, my muscles are like just all kind of tight, and it just
Yeah.
like
Yeah.
blocks everything. So I
Yeah.
am now like 24 hours without practice, and I'm like, I can feel that same thing as well.
Yeah. And now that we all have our smartphones and our devices, I noticed that my attention span I've heard somebody say that our attention span is now shorter than a goldfish. I need to verify that. But I think
I've
a
heard that
goldfish
as
attention,
well. Yeah.
like,
I'm not
wow.
sure if that was like a double-blind study of goldfish,
Yeah, probably not.
but
That could be a little hyperbole, but
yeah, but
the
I've
point is
heard the
well
similar
taken.
things. Yeah.
I also noticed that when I do my breath work, my attention and my attentiveness is just so much better,
Yeah.
especially if I can get it done in the morning too. That helps. Or on the flip side of it is when I'm not, it's like, man, my attention span is, I kid around and say I now have adult onset ADHD, but I'm kind of kidding, but not, it's just like, wow.
Well, we
So
were talking about just the stress in the world as the time we're
yeah,
recording this, and like I'm
yeah,
working on a grant, and I like I've also got like CNBC on, and I'm and I'm like, wait a
yeah,
minute, like this is what I teach people not to do, but I think when our
right,
stress level gets so high, it's like I'm not getting anything done, and I'm just feeding that anxiety,
right.
to destroy my quality that I'm giving to the task.
I think I'm going to create T-shirts that say "Stop, Drop, and Breathe."
Yeah, I love it. Sign me up for one. Maybe we can
Yeah,
put our logo on the back.
that's it. Yeah, there you go, for
No,
sure.
I'm also curious because one of the things, and this kind of crosses personal professional for me, is in psychology we paid a lot of attention to strategic tapping,
Yes,
like cross lateral. And if you're not watching the
yes.
video, I'm crossing my arms here and tapping my shoulders, to help support, kind of like the EMDR thing where we're supporting emotional regulation during
Mhm,
traumatic recall. As far as I understand, associated with acupuncture points. The personal side of this is doing some work with Chinese practices and
mhm,
Qi. Like, I
mhm.
still like do the little massages at
There you
pressure
go.
points. I don't know how this is related to my heart or this to my
Right.
kidney, but I don't know, like some thousand years ago, a lot of wisdom there. So I'm curious as you've got the dry needling acupuncture as well as the chiropractic. I'm curious if you have integrated any of that just into kind of your day to day. Are there any kind of acupuncture points that you're doing something with, or is that just more of a, oh, I feel a little headache and I know where to hit that to get rid of it?
Oh, that's a great question. Um, so interestingly, I'm not versed in the EMDR, you know, approach, um, but out of AK, it's taking an applied kinesiology class years ago. Um, so just below the clavicle
Yeah.
here. So for those of you who can't see, I'm touching just below the clavicle near my sternum on the left side with my right hand, two fingers, and then I'm doing the opposite on the other side. But the trick is you can't have your fingers touch, just like Ghostbusters, don't touch the streams, because then your brain is able to figure out what's happening there. But that's a really great reset when I'm feeling tightness in my chest,
I love that.
stress. But that's kind of a similar thing. And if you're not sure where to press, just kind of dig around a little bit in that space just below the collarbone and start working towards the middle, towards your sternum. You're going to find like a little tender, sweet spot. And so
Yeah.
you work that. Um, so and then yeah, full disclosure here, I'll also do acupuncture. There's auricular therapies. There's a lot of acupuncture points in the ear.
Yeah.
Doing acupuncture on yourself, I mean, have I done it? Yeah. ears is a little bit easier. Those are great stress points. Battlefield acupuncture points for pain. If my back is hurting or if I have a headache. Um, yeah, that's a great question. As clinicians, I think sometimes we don't necessarily make the best patients. Um,
Well,
you know,
having been a patient of a chiropractors, you all give us homework. Like, I don't
yeah,
think I've ever left an appointment without you expecting me to do something at home. So
yeah, yeah,
I like that you have to sit with this a little bit, my friend.
yeah, yeah. I think that for me, the big challenge is getting out there and getting the blood flow and doing
Yeah,
cardio regularly, and that's,
yeah.
um, you know, taking my own medicine and following my own directions. And that's huge. And that's from an anti-aging point of view. I'm 55. I want to be the crazy grandpa rock climbing with the kids.
Yes,
You know,
yes.
grandpa, don't step on that rock. Um, and so that's kind of a motivator to look at a lot of these modalities that are just becoming available,
Yeah.
like tracking HRV and intermittent fasting. As a side note, circling back to HRV, um, and maybe I just haven't found this on some of the other content with the podcast, but with intermittent fasting and 24-hour or 36 or 72-hour water fasting, mineral fasting, the HRV tracking that during that has been mind blowing.
Yes, yes.
Because I've done some fasting, and the first time, like my HRV, my baseline just my I had a new baseline. It wasn't just
Yeah.
like a spike. You take a grain with salt. If you have a spike or a dip, okay, fine.
Right.
But seeing that consistently afterwards, like holy cow, my
Yeah.
my physiology really, my neurophysiology really likes the fasting.
Yes.
And so I repeated it too soon. So it was actually the week
Mm.
following, I did another 72-hour fast. And that was really telling because I felt pretty good, but my HRV was just trending down and
Yeah.
down and down. Like, okay, even though I don't feel any different in my body right now, I'm stressing the system out.
Yeah.
And so it's been a really great tool.
Yeah.
I'll use the HRV reader in practice with patients as really a tool for them. And I think uh, the best application in the clinic thus far is really empowering the patient to do their biofeedback, do their breath work, because that's a lasting tool.
Yeah.
Stress management wise, that will learning their own body better, in addition to what I'm also offering.
Love that.
Um, but yeah, so
So I'm curious. I love to kind of start to wrap up on this question. Is
yeah,
you mentioned that as a younger man, you were a smoker. I'm assuming that didn't go too far into adulthood, but
no,
no, and I'm just curious because having turned 50 this year as well, I like it really it has forced me to look forward. Like,
yes,
okay, how many snowboarding seasons do I have left?
yes,
How I love my 20-mile hikes. How do I keep
yeah,
doing that? So it's been a really shift, and I'm just happy that I started these other habits 10,
yeah,
15, 20 years ago that
yeah, yeah,
I like to go back. I like 30 years ago, I like to go back and kick myself in the butt. But 20 years ago, I'd like to go
right
back and
on,
thank that person for getting me here
right,
now. So
yeah, yeah.
I'd love for you, like, if you were to go back and maybe the last kind of year you were a smoker, kind of as a fun piece to do, what would you tell your younger self that like, hey, we are going to hit 55 eventually. Here's some of the things I'd like you to start to think about. What would maybe some of the advice you would give your younger self and maybe some of our younger listeners as well?
Yeah, for sure. I would tell my younger self, stop eating sugar.
Yes.
For one,
Yeah.
tastes great, but stop eating sugar. You're gonna feel better.
Yeah.
Um, and obviously stop smoking. I quit when I was 23. I'm 55 now. Um, and I would tell my younger self, you know, stop, drop, and breathe, and then the fourth thing would be get exercising, get moving. I wasn't a terribly sedentary kid, but I did not understand the role of, yeah, I would go to the gym and I would live, but I did not really understand the role of really good cardiovascular training, interval training, and those things. Because, yeah, the time, it's never too late, right? But the
Yeah.
time making those course corrections younger can put you on, can put a person on a better trajectory when they are 50 or 55. I'm not making this up. I feel better at 55 than I did at 30.
Yeah.
My back doesn't hurt. My neck and shoulders don't hurt. I mean, I'm working on people all day long. I have a pretty physical job, and my energy is best it's ever been. And so this is really cool. Like going into my future years, throttle forward,
Yeah.
game on, man. Let's go.
And besides of what you mentioned, because that's a powerful thing, I'm always, man, I just have recency bias that do I really feel better than I did at 25? And I think the
Yeah.
answer is yes, but
Yeah.
part of me really wants that to be true as well. So
Yeah.
I will say that there's a bias to that, but I kind of really believe it as well. Are
Yeah.
there other things that maybe you haven't mentioned yet? I just don't want to lose the opportunity
Sure.
that allows you to say that I legitimately feel better today than I did 25 years ago because I look around me at some of the friends that I grew up with, and I know that the opposite is true. And sometimes
Hmm.
to and diabetes and other
Hmm.
chronic diseases have crept in where they don't
Yeah.
see a healthy 70 in their future. Like,
Right.
I'm like, I hope I'm still, doing black bumps, on the
Yeah.
snowboard
Yeah.
at
Yeah.
70, where
Yeah. Right.
they kind of question of whether or not they're going to be around at that
Yeah.
age. So, were there any other kind of hacks or anything we didn't talk about? Because I don't want to leave without getting any more juicy tidbits from you.
I mean, the fasting is a great hack, which
Yeah.
I talked about. That's super powerful. Nutrition wise and supplementation wise, I mean, there's so much good stuff out there. I mean, I wouldn't direct necessarily to, yeah, bone up on your nutrition and
Yeah.
evaluate that. That's a huge piece to the puzzle too, right?
Yeah.
But
Absolutely.
yeah, and sunshine. I
Yes.
Okay, yeah. The other hack is red light. I have a red light table, full body red light therapy in the clinic, and that's really really great too. Nothing is a replacement for sunshine. That's the bottom line. That's where we're supposed to get it. So, um,
However, growing up in your neck of the woods, that is not always out. So to have that
no,
table as a backup during the long
yeah,
Chicagoland or Midwest winters, I'm sure it gets quite a bit of use. Especially during those winter months.
yeah, for sure. The secret is bundle up and get out there, get
Yeah,
outside, get out in the woods, run or
yeah,
walk or what have you, and make a friend of the cold. You get your life, whatever you have to self-talk you need to do to get out there,
yeah.
do it.
See, one reason I moved to Colorado, one, we got sun in the wintertime, and
Yeah,
two, winter's now my favorite season because we get to go out and have fun in it. So
yeah,
that
for
was
sure.
not everybody needs to move 1,200 miles away to improve their wellness, but I
Yeah,
know for me that has been it's like I'm happy in February. Why am I happy in
yeah,
February? It's like, oh, the sun's out. Like,
yeah,
this is nice. I like this.
yeah.
So, yeah, I have a lot of empathy for my Midwest family still who they're not all that happy in February. So I'll
Right.
tell them about your table.
Uh,
Awesome, my friend. Well, Steve,
Matt.
I knew you were the right person to get
Oh,
on around this topic. I just
right on.
appreciate your work, and
And I'm so grateful for you guys and what you're
thank
doing there.
you.
You're doing in work, and you're really impacting people's lives, and I could attest to that firsthand. I'm your biggest
Well,
fan.
that is a huge treasure to give, and I will pass that on to the team as well. So we'll put information around Steve and his work in the show notes that you can find at optimalhrv.com. Steve, thank you so much for your
Oh,
time and
my pleasure, Matt. So good to
sharing
talk
your
with you.
life journey.
Okay, take care.
Awesome. We'll see everybody next week.